Day to everybody. It seems like a nice time to shoot a video here. I'm hiking up in Ontario County Park in the Finger Lakes region in New York State. I wanted to address some questions and concerns and maybe some confusions about my philosophy and the approach that I take to manual therapy, manual care, whether it's for voice and swallowing or more generally in the body. And there's often some confusion when I introduce the concept of a patient-led model versus a therapist-led model. And the fact that we as professionals learn pathology, we learn tissue-based models, we learn all sorts of models of dysfunction, and whether it's one that's driven along muscle tension or spasticity or scar tissue, fascial restriction, trigger points, you name it, we've learned it, right? It sort of leads us down this road where we become the person who determines pathology and the problem, and we also tend to be the ones who are gifted with the opportunity to tell the patient what needs to be done in order to get rid of the problems. Now, if we move beyond that therapeutic model where we're dealing with dysfunction and you move into what might be called function or hyperfunction, the clinician is often put in a similar sense or a place of responsibility where they're the ones who basically prescribe the intervention, and the client and or patient is sort of the passive receiver, and they nod their head because they come to see us. We are the expert, and they are coming to, without sounding too sarcastic, to receive our gifts. That model, it works. I don't want to ever discount that, even though my sarcasm is evident. But I do think that there's a line that we as practitioners can sometimes cross, and at times the line is self-serving if we cross it, where we're making recommendations that we've been taught are the right recommendations, but in the greater view, they end up serving us sometimes more than the patient, in that we're teaching them that they've got all these problems and that they need our help. And oh yeah, the help, it may even take a while to move through some of these pathologies. And the self-serving aspect is it strokes our ego because we're repeating what we think is important and maybe what we've seen as helpful, but it also ends up gifting us repeated visits and income. And I'll tell you right now, in this coronavirus time, that sort of model is one that has its charm, since there's a lot of people who are really suffering economically. But the problem with a model like that, to me, is that it builds on the vulnerability, on the passivity of the patient, where they simply are taking what we tell them is wrong with them and agreeing to terms with us that what we think is best for them without truly empowering them to play an active role in this process. What I'm putting forth with the model that I teach and use in my practice is, all right, you can't totally give up our power, what we know, why they come to see us for expertise, but I'm requiring and at times demanding that they participate, that they tell me what they're feeling, and not only what they're feeling, but is that feeling familiar? Does it feel important? Does it feel relevant? Does it feel like we've tapped into something that is the reason why they're in my office seeking care? And by taking that even further, allowing them and at times requiring them to tell me, is what I'm doing with my hands, and in reality, in the larger scheme of the therapeutic process, does it feel like what I'm doing could be useful? I'm basically forcing them to come into the role of decision maker, maybe as a partnership, a therapeutic alliance. And at times, that's a flexible line that will sometimes sort of nudge them back in the direction where they're making more of the choice. Or sometimes, I'm guiding them a bit too. It's a bit of a zigzag process. All I'm asking here is if we can let go of our ego to a certain extent, let go of what we think is important, and allow more of a therapeutic alliance to basically require them, the patient, the client, to play a much more active role in the process. I personally think that it's honoring more aspects of the biopsychosocial approach to medicine, to health, to fitness, to care, to performance, versus being so fixated on what we think is what's wrong with their tissues. All right. So if you've got questions, if you've got confusion, if you want to yell at me because you don't like being called an ego-based approach therapist, let me know. I certainly understand that. I'm not dismissing what you know, what you've learned. I'm just asking you to sort of get your head out of the rabbit hole a little bit and see it from the perspective of the patient instead of just the perspective of the clinician. Thanks for listening.